Okay, good morning, everybody. I call to order today's Judicial and Public Safety Committee on August 1st, 8 a.m. Can we get a roll call, please?
Chair Evans.
Here.
Member Chaplin.
Here.
Member Childress. Member Desart. Member Eckhoff. Member Guston. Member Krajewski. Member Ozog. Member Schwarzy. Member Tornatori. Member Yu. Member Zay.
Thank you. Do we have any public comments?
No public comment today.
Okay, thanks. So for today's chair remarks, this is going to be, we've got a very full agenda today, so I want us to try to keep the meeting going so that we don't lose quorum. And we have two budget presentations today. So I just want to remind us to keep any questions related to budget, just so, like I said, try to keep this meeting going. So on that remark, on that note, can I get a motion to approve the meeting minutes from last? Okay, all in favor? Okay, motion carries. Next we go to procurement requisitions. Can I get a motion to approve can I get a motion for JPSP 005823, recommendation for the approval of a contract purchase order to Insight Public Sector Inc. for the purchase of UPSs for network closets for the Sheriff's Office for a contract total amount not to exceed $32,261. All in favor? Oh, any discussion? No. Okay. All in favor? Okay. Motion carries. The next one, can I get a motion for JPSP 005923, recommendation for the approval of a contract purchase order to C5 Solutions Inc. for the annual maintenance service agreement for the probation case management systems for the period of August 9th, 2023 through March 31st, 2027 for a contract total amount of $570,991. $570,991. Any discussion? All in favor? Okay, the motion carries. Can I get a motion for JPS P006023, recommendation for the approval of a contract issued to Stannard and Associates to provide exams for deputy sheriffs seeking promotion to the ranks of sergeant and lieutenant for the Sheriff's Merit Commission for the period of August 8th, 2023 through November 30th, 2024 for a contract total amount not to exceed $73,700. Any discussion? All in favor? Okay, that motion carries. We move on to resolutions. Can I get a motion for FIR 017123, acceptance of the Illinois State Opioid Response Criminal Justice Medication Assisted Treatment Integration for $25,000? There was a motion. Was there a second? Okay. All in favor? Okay. Let's move on to FIR 017223, acceptance of the Illinois Law Enforcement Training Standards Board Law Enforcement Camera Grant in the amount of $31,104. Any discussion? Okay, all in favor? Okay, the motion carries. Can I get a motion for FIR 017323, acceptance and appropriation of the Donated Funds Initiative Program Grant intergovernmental agreement in the amount of $103,119. Any discussion? Okay, all in favor? Okay, motion carries. Can I get a motion for FIR 017423, acceptance and appropriation of the ILDCSS Children's Advocacy Center grant in the amount of $312,185. Any discussion on this? All in favor? Okay, the motion carries. Next, we move on to budget transfers. Can I get a motion for item 232525, transfer of funds from accounts other professional services to regular salaries and employer share Social Security in the amount of $2,886 to realign the grant budget to account for final expenditures? Any discussion on this? Oh, wait, sorry. Was there a motion? Any discussion? All in favor? Okay, motion carries. Can I get a motion for 232526, transfer of funds from IT equipment to software maintenance agreements in the amount of $32,000 needed to cover the costs for the upgrade to the current probation case management system release. The current release is 10 plus years old and unsupported. Any discussion on this? Okay, all in favor? Okay, the motion carries. Next, we are moving on to action items. Can I get a motion for item 232527, decrease and close purchase order to HOV services in the amount of $372,277.22. Any discussion? I see members A.
Yes, thank you, Madam Chair. This is in for this one. You know, it'd be nice when you go to read this, if there would be some kind of decision memo on this, just a couple lines on all the decrease closeout, not only for this committee, but for all committees. Because you go in and look and it's like, you know, contractor couldn't do it, or, you know, we went with another vendor or something, but it seems like on all of them, there's really no information why we're decreasing, closing out on all of them. And just not for this committee, for all committees. It'd be nice to have just a little something in there so we know what's going on, why we're closing those out.
Okay.
You know, contracts up and we saved money or something. So it'd be nice to know.
Okay.
Thank you.
Thank you. Any other discussion on this? Okay. All in favor? Okay, motion carries. Moving on to item 232528, county. Can I get a motion for 232528 county contract issued to Alliance Technology Group LLC to decrease the total contract amount by $469,920.77 to close the contract. Any discussion on this? All in favor? Okay, motion carries. Okay, moving on to, can I get a motion for 232529 county contract issued to Scientel Solutions to decrease the total contract amount by $71,000. There's something wrong with that number. 67.90 cents to close the contract. Any discussion of this? Okay, oh yes. Sorry, can we get that one? Okay, we'll come back to it. Okay, so let's not take a vote. Do we not take a vote on? Okay. All right, we'll come. Okay. Okay. Okay, we will pass it and we will get the corrected number so everyone knows. Okay, so
Madam Chair?
Yes.
Oh, thank you. Could I make a motion to combine and approve 9D through 9I because they're all closeouts of contracts?
Okay, is there, okay, we got motion in a second. All in favor? Okay, I will proceed. Can I get a, okay, so I'd like a motion to approve 232530 county contract issued to Public Safety Direct to decrease the total contract amount by $190,361.36 and close the contract. I'd like to approve 232531 county contract issued to Gall's Parent to decrease the total contract amount by $61,500.10 to close the contract. I'd like to get a motion to approve 232532 county contract issued to Ray O'Haron to decrease the total contract amount by $25,826.26 to close the contract. I'd like to get a motion for 232533 county contract issued to Contract Pharmacy Services to decrease the total contract amount by $125,194.34 and close the contract. I'd like to a motion for 232534 county contract issued to Warehouse Direct to decrease the total contract amount by $11,342.44 and close the contract. I'd like a motion on 232535 county contract issued to Carroll Stream Stratford Inn Limited to decrease the total contract amount by $37,266.80 and close the contract. All in favor? It wasn't second? Oh, there wasn't a second. Sorry, was there a second? Okay, now there's a second. Okay, sorry. All in favor? Okay, motion's carried. Moving on to grants. Oh, wonderful.
The number should be 71,676.90.
Okay, so I would like to, can I get a motion for item 23, 25, 29 as corrected for the county contract issued to Scientel Solutions to decrease the total contract amount by $71,676.90 and close the contract. Okay, any discussion on this? All in favor? Okay, the motion carries. Okay, so let's then move on to grants. Can I get a motion for item 23, 25, 36, GPN Illinois State Opioid Response Criminal Justice Medication Assisted Recover Integration, Illinois Department of Health and Human Services in the amount of $25,000. Okay, all in favor? Should I combine? Can I get a motion for 23, 25, 37, GPN 4123, Illinois Law Enforcement Training Standards Board Officer Recruitment and Retention Grant Program for $40,000. Any discussion? All in favor? Okay, the motion carries. Can I get a motion for 23, 25, 38, DCFS Children's Advocacy Center Grant, Children's Advocacy Center of Illinois and DCFS U.S. Department of Health and Human Services in the amount of $312 and $312,185. Any discussion on this? Okay, all in favor? Okay, the motion carries. Next, we move on to travel. Can I get a motion to combine items 11A through 11C? Okay, all in favor? Okay, so I'd like a motion for 23, 25, 39. Authorization is requested for the Director of the Office of Homeland Security and Emergency Management to travel to Springfield, Illinois from September 4th through the 8th in 2023 to attend the Illinois Emergency Management Agency and Office of Homeland Security 2023 Training Summit. It is beneficial that the director attend this training summit, which will include various training sessions and meetings. The cost to DuPage County is $670.10 for lodging, meals, and miscellaneous expenses. I'd like a motion for 23, 25, 40. Authorization is requested for an emergency management coordinator to travel to Springfield, Illinois from September 5th through the 8th in 2023 to attend the Illinois Emergency Management Agency and Office of Homeland Security 2023 Training Summit. The state of Illinois has requested that he bring the rapid communications vehicle to Springfield to be demonstrated at the training summit. He will also give a presentation on auxiliary communications and assist with STARCOM interoperable communications presentations. IEMA is providing lodging for presenters. The cost to DuPage County will be $282.50 for meals and miscellaneous expenses. I'd like a motion for 23, 25, 41. Authorization is requested for OHSEM volunteer to travel to Springfield, Illinois from September 5th through September 8th, 2023 to attend the Illinois Emergency Management Agency and Office of Homeland Security 2023 Training Summit. The state of Illinois has requested that the rapid communications vehicle be brought to Springfield to be demonstrated at the training summit. This volunteer will be assisting the emergency management coordinator in staffing the rapid COM4 vehicle while on display and discussing its capabilities with attendees. The cost to DuPage County is $670.10 for lodging, meals, and miscellaneous expenses. We had a motion. Is there a second? Thank you. All in favor? Okay, motions carry. Moving on to informational. Can I get a motion to place on file item 23, 25, 42, Public Defender's Office, June 2023 monthly statistical report? Any discussion? All in favor? Okay, motion carries. Next, we are moving on to the budget presentations. We have today the DuPage County Coroner, Dr. Richard Jorgensen.
Make presentation. Should be pretty quick. I'm going to present some of the changes that occurred since 2012 when I took office to now, review the expenses of the office and a review of the toxicology and autopsy costs. Next slide, please. Thank you. 2012, when I became coroner, we had 4,363 cases reported in our office. Last year, we were up to 6,600 cases, a 53% increase. During that time, we've had no increase in the number of deputies or employees related to investigating cases. We take care of this increase by increased efficiencies and procedures. Next slide, please. Number of autopsies were 243. Last year, we did 415, 70% increase. Just to make a point that our chief forensic pathologist is an amazing person, very unique person. There's only 500 forensic pathologists in the entire country, and we have one. The National Association of Medical Examiners suggests that 250 autopsies a year is a full-time load for a pathologist. You can see we're up to 415. So the potential, I believe that we're going to need to have another pathologist within a short period of time. Right now, we fill that void with independent contractors. Next slide, please. What do? We investigate cases and administer our office. The other costs of it, so that all of that is just salaries, and you'll see that most of our budget is salaries. The other three things that we do is we transport bodies to and from our office. We perform autopsies. Where that costs money is in the employment of a full-time forensic pathologist and ancillary independent pathologists and ancillary testing, the toxicology testing and x-rays. Next slide, please. The administration of our office, we have 2 administrative assistants. We have 10 deputies that work 24/7, 365. And we have worked every hour of every day through COVID and every other thing that's happened in this county. Next slide, please. Again, we transport bodies. That's about 1/3 of our extra or non-salary costs. We hire an independent contractor to do that removal and transport of bodies. The cost of that went up about 15% last year. Next slide, please. We perform autopsies. Again, the half of the autopsies are done by our chief forensic pathologist, who is a full-time employee of the county. And we have independent contractor forensic pathologists. The cost of doing an independent autopsy is $1,100. That cost has gone up 10% in the last year to maintain our parity with surrounding counties. Next slide, please. Ancillary testing. One of the largest things is toxicology testing. With the current level of funding, we use NMS labs, which is the best lab in the country and is a national standard for toxicology screening. It allows us to use the state-of-the-art testing technology, identifying, collecting relevant data. It's very important because they are a national lab. They know what's going on nationally. They know what drugs are coming in and out of favor, and they pare down their testing. But when we do a toxicology test, we test for approximately 250 legal and illegal drugs. And for example, when the bath salts were in, they tested for a lot of bath salts. Now they're out, and so we don't test for as many of those. But it also allows us to analyze current data and be a leader locally and nationally in identifying trends and such. Next slide, please. The other cost for ancillary testing is x-ray. We have an in-house digital x-ray machine. We actually have 2 of them. This is a huge savings for us. We're one of the only counties that has our own x-ray department. And for example, Kane County will have to take their body, transport it to a hospital, have x-rays done, and then transport back. I estimate that that the savings for us having this X-ray in-house is at least $125,000 a year. Next slide, please. I just wanted to, we have a lot of new members. I wanted to, yeah, I think it's the next one. Next one. Oh, coroner fee fund. We also have a coroner fee fund. In the past, the expenditures of these funds have been to help yearly operating costs. We completely rebuilt the primary X-ray units in both places with new state-of-the-art digital X-rays. That was paid for to coroner fee funds. Record digitalization project. All of our records had been previously microfiched by a previous coroner, and they did not know at the time that microfiche rots, and all of our records for the entire 100+ years was rotting in its boxes. And we, with the IT department, completely digitized our records. We paid for half out of the coroner fee fund, and the IT department paid for half. We also bought a body lift, which is fairly expensive, but very important for work person safety. Next slide, please. We pay for most of the education of our department, which is very important for us to stay up to date. Mass disaster preparedness. We have mass disaster preparation for 150 deaths that we can right now go to a scene of 150 deaths and have all of the body bags, equipment, and everything that we need for that. We recreated our evidence lockers and evidence storage. We pay for indigent burials. We pay for outside meetings. I am currently on the health steering committee of NACO, thanks to member Jim Healy, who talked me into doing that, but provided no funds for us to do that. So we pay for that out of the coroner fee fund. And we are currently going to replace 5 of our vehicles that we're going to pay for out of the coroner fee fund. Next slide, please. Just to let everybody know, because we have a lot of new members, state law states that all costs of autopsies, medical examinations, laboratory fees, and any expenses relating to that should be paid for out of the general fund. Next slide. Any questions, comments?
Thanks for the presentation. And it seems like your workload's gone up quite a bit over the last few years,
yep.
But the population of DuPage County hasn't. So why is that?
Drug overdoses and suicides.
We
went from when I first started, we had 38 drug overdoses. Last year we had 150. But we also, I would say that we're more diligent. And there are counties, for example, that require all deaths in the county to be called into the coroner's office. That's purely up to our discretion as to what to require to be called in. That would require us to do 10,000 cases. We couldn't do that. And there's no reason to do that. When somebody dies of cancer in a hospital, they don't need to be called into our office. But the amount of cases, people that die without doctors or die at home, just lots of what we call coroner cases have just increased over time.
Okay. And then I know a few years ago you had indicated that on a few occasions there were security issues at your office with families coming and
we're very good on our security issues. We've converted to being completely locked down, and we have a very good relationship with security and such. And any time that we've had problems lately, we've been well covered. Thank you.
Okay, thank you.
Member Zay.
Thank you, Madam Chair. Rich, good morning.
Morning.
Thank you so much. I mean, these numbers are kind of staggering. 53% increase in cases, 70% in autopsies. And I can't thank you enough how efficiently you run your office. I think if this was any other county department or countywide, they'd be in here asking for a lot more money. And we really don't hear from you that often. So I think that shows your professionalism and you are stretching your dollars to the max.
Thank you.
So I can't thank you enough when, you know, times are tough and everybody's here beating down our door for additional stuff. We haven't really heard from you. So we really appreciate it. And then, like I said, with these increases, I mean, it's something obviously we're going to have to look at in the future, but the way you've handled your office and efficiently like you have. And again, it's hard. Like we had a lot of offices here that were closed down during COVID. You guys are open 24/7. So again, I can't thank you and your staff enough for all your work over the years.
Thank you. I'll pass that on to them.
Thank you, Member Chaplin.
Yeah. Thank you so much for the presentation. Just a couple questions because your caseload has really increased a lot. Has technology helped you at all from when you first started to now? Has that helped alleviate some of the workload that you're able to do a little bit more with less?
Yes, I can't say enough about our IT department, which is, I think, one of the greatest assets that we have. They have created a coroner system from scratch. Most counties buy the stuff, and there's whole bunches of companies that do that. Our IT department, and they did that before I got here. I have to admit that. Now they're so fluid and helpful that when for example, we had a situation where the next of kin is a very important legal entity. They're the person who we have to deal with the deceased and their properties and stuff like that, as opposed to what's called a contact, a girlfriend, somebody they've lived with for 10 years. Those people have no legal rights to the person, but the next of kin does. So I realized that we were mixing these up in our system. So we created a contact box and a next of kin box so we can make sure that we kept those. That was just a matter of a phone call and working with them. So they have been absolutely amazing. But early on, one of the things that I did was to create all of our records are electronic now. So within the first year of me being here, we've converted completely to electronic records. We used to make 5,000 manila folders a year, and we had what's now 3 offices, just manila envelopes. And honestly, nobody ever looked at 99% of them. You know, it was just a waste of time and money. And so we've converted completely electronic. That really helps a lot. So between the coroner system that we have on all of our computers and being electronically based, it really helps a lot.
That's great. And then I noticed you mentioned that you transport bodies. So are you taking those to like funeral homes and things like that? Or where do you transport?
When we go to a deceased to somewhere where there's a deceased that we're going to take control of, we bring them back. And this has been before it's so long that our longest employee can't remember when it wasn't done that way. There's lots of places like Kane County, they do their own removals. The deputies do that. I consider that to be difficult. In the last couple weeks, we've had a 550-pound person, a 600-pound person. This is really difficult for the staff to do that. And so for workman's comp and health of our employees, I think it's really important that we have a removal service. But anyway, so when we go, let's say we'll go to a home and there's a deceased person there or that's committed suicide or something like that. We take control of that body as a part of our legal investigation, and we'll bring that body back to the morgue. And we, being a locked facility, we control that evidence, which the body is evidence at that point. And so we pay for that.
Okay, great.
It's very interesting that Chicago does not pay for that. So like Hanover Park, which is half in Cook County and half in DuPage County, the DuPage County part, we pay for the removal of bodies. And in the Cook County part, the city pays for that. So it's just kind of interesting how that happens.
Okay, great. Well, thank you so much for the presentation, and I appreciate all the work you do. And then, I have to see about these deaths with these overdose and the suicides to try to, so we can curtail those at some point. But thank you very much.
Yeah, thanks.
Thank you, Member Chaplin. Member Guston.
Thank you, Madam Chair. Thank you, Rich, for the great presentation. It's a lot of information, a lot of good information. You kind of touched on the possibility of needing another pathologist, particularly with 243, and it's increased to 415, which is 70%. Do you anticipate that for this year or next year, or?
Well, I'm very concerned about that. As I said, they're currently in America, not in Illinois. In America, there are only 550 board certified forensic pathologists. We're blessed to have one of those. And so we're also blessed to be next to Cook County, and we have a number of retired and still working Cook County pathologists who moonlight, that shouldn't be a word I should use, that work on the weekends to cover, and holidays and vacations to cover our pathologists, and they do that extra amount of work. So I've been talking for a while now with our pathologists about thinking ahead, about, you know, that we need to think about that. The people who are filling in the void right now are very happy filling in that void. There's a couple of retired but very active pathologists. They want to continue to do this work. But I think if either of those two major people retire, we're going to have to think about hiring another forensic pathologist, which is going to be difficult and expensive.
And in the drug testing that you do and send out, is the THC testing any different than, let's say, alcohol or anything? No. Or, I mean, my understanding was sometime back it took weeks to find somebody who could identify THC in the system or test for it or whatever. Is that changed?
No, we have THC is a standard test. And it's done on every time we do a toxicology. We do multiple different drugs. We do the Delta-9 THC and the L11 and the different things. And those are different breakdown products and the active drug in cannabis. What's cost so much money in our toxicology testing is prior to 2015, you know, we just called it the heroin crisis. So it was really simple. There'd be cocaine and there'd be heroin. And now we have 50 different fentanyls. We have, I've talked about it before, but typical toxicology report will have 10 different legal and illegal drugs in it. And so the complexity of what they have to test has gone up tremendously, and the cost of it also. We used to have to pay extra for fentanyl testing. Now it is so common that it's actually part of the routine testing. But it's went from being less expensive because it was all common drugs. It was heroin and cocaine, and now it's 10, 15 different drugs in the system. It's extremely expensive.
Thank you for your hard work. Thank you.
Thank you, Member Guston. I just want to remind everybody, let's keep these questions to the budget. I would love to have our coroner come back at some point though and give us a presentation, because this really is fascinating. Member Krajewski.
Thank you for your presentation, Rich. Just to follow up on Member Guston's question, you mentioned that because of the increase, maybe need for pathologists, contract work now. How much is you paying for the contract portion of it right now? You know?
Yeah. I think it's 100, and we have budgeted 165,000 for next year.
And that's just for the contract. So I mean, it's, you go for a full-time person, you maybe 200 and some thousand. 260, 70. There's a job offer in Houston, Texas right now for $410,000, and they can't fill the job. But what I'm thinking, maybe you should be moving sooner than later.
It's foremost on my mind for sure, because I'm very concerned about our future in regard to that.
Because if you lose the current one, at least if you have two, if you lose one, you still have one. But I would say you start moving forward, and we can, if you need the money in the budget to do that. But I think you start the process of trying to find it with only 500 is better to do it now than after.
The good news is that this is a very desirable place to be and to work. And so we continue to have that.
So what's the holdup for not doing it right now? Is it the money? Is it?
No, just that we have adequate coverage. And when I bring the subject up, the people that are working right now are very happy with that and that type of thing. So, yeah.
Okay, so we're going to wait till these happy people, contractors, or
well, I ask regularly. I can tell you that we're still well covered, and it's very important and on my mind. Thanks. Yeah,
thank you.
Thank you, Member Krajewski. Next, I have you and Member Tornatore. You wanted to ask a question also. Oh, okay. Okay, so Member you.
Thank you, Madam Chair. Thank you, Dr. Jorgensen, for your presentation. I really appreciate the work that you and your staff do every day, all the time, even during the pandemic. So my ears also perked up when you had mentioned the new pathologist, and I was wondering if that was actually included in this current budget that you had that was emailed to all the board members. I know that you talked about the $165,000, but I'm wondering if there would be any more.
$265,000.
$265,000.
Yes.
Thank you. And if there would be cost savings if we were to actually hire somebody, like you were stating, I understand that in Houston it's $410,000. So, but just in general, I wasn't sure if it was included already in this budget if we were planning on hiring somebody.
Well, the current forensic pathologist has been an employee of the county for 10 years now, and so her costs and benefits and everything are in our budget and have been for years. Also the costs of what we project that we're going to have to pay is also in the budget. Okay, but it's kind of interesting. I was going to just comment about that cost. Is there's a lot of, because of that law that I showed you about that all autopsy related costs are paid for on the general fund. There's a lot of counties in the state that do not even have any of this in their budget at all. Just when an autopsy is done, the bills are sent to the treasurer and they're paid for. So we're not unusual. There's lots of counties that try to think about what it's going to cost, and that's what we're doing. You know, we can't tell. We've gone up every year that I've been here in the amount of autopsies we do, and we try to project that, but obviously we can't know that for sure. Last year we were absolutely so lucky in Willowbrook that people were horrible shots, and you know the gunfight that occurred down there, we could have had 20 or 30 dead people, and so we have no idea about what the future is going to hold.
Thank you. Anybody else? Member Krajewski.
Just one follow-up question. Did you get the salary range for the pathologist fixed with HR?
Yes, I did. Thank you.
Okay.
Yeah, we finally there is no salary range for somebody that there's only 500 people in the country.
It just looks bad in the county when everybody has to stay between the ranges, right? Except we have this one that's not in the range, which means the range is out. If Texas is 410, right, the range has got to be bigger.
Right.
So
that was a problem that we got over.
Okay, great.
Yeah, thank you for asking.
I'm glad that got fixed. Thank you.
Thank you.
Okay, thank you very much. Next, we move on to our Office of Homeland Security and Emergency Management, Director Craig Beekman.
Good morning, Chair Evans, members of the County Board. I'll get right to it. This year's presentation focuses on the variance between FY 2023 and the request we have for FY 2024. And I'll start with the Homeland Security and Emergency Management side of our organization, then move on to campus security. So the slide you have is the overall broken out by category. The variances, we're at about a $70,000 variance for personnel. This is primarily due to COLA, merit, and market adjustments from the FY 2023 fiscal year. We did end our paid on call program in February. That saves us about $5,200 a year. And we have a very active and expanding volunteer program. And then lastly is to reclass one employee later this year to better represent the organizational needs of the department. The next slide. On the contractual $8,800 variance, primarily budget neutral. We're now picking up the cost for our copier anniversary awards. Some radio airtime kicks in this year for the radios that were authorized by the county board last year. Our new pickup truck arrived last week, I'm told, so we're very happy to have that. And they'll cost a few dollars to get that outfitted with lighting and whatnot. And then our travel increase, we're asking for a little more money there now that we're post-pandemic. Meetings have resumed downstate, and we're very active with training. And then lastly, we did reduce by about $4,000 across some of our other accounts. Lastly, we have a capital outlay of $16,000. You may recall that last year, the county board authorized the purchase of 10 StarCom radios in an agreement with ETSB, and it was over a 4-year payment plan to ETSB. This is the first of 4 years for $16,000. And we'll move on to campus security. Same thing, there's the overall slide. Our personnel, about $9,000 variance, again, COLA and increases from FY 2023. Next slide, commodities, just a slight variance. Again, when we received our 10 radios, the security division also received 4. This is the first of their 4-year payments. It's about $8,000 in radios. Then contractual is our largest variance, and the bulk of that is a security contract increase. So when the FY 2023 budget was prepared, it was based upon the current rate. And then we also accounted for an increase. We knew that we'd be going to a new security contract later in the year. We did that in around January timeframe. And as we might expect, the hourly rates are even higher than were expected. Additionally, we've added hours to the number of hours that are required due to the magnetometers. And collectively, that accounts for that contract increase. Also, Chief Briggs has requested $75,000 in addition to the $56,000 that is in their year-to-year budget for alarm panels and camera equipment. The panels that we have now are 28 to 30 years old. They're failing, and we can't get parts for them. We're dealing with this right now with one panel in particular that sustains some damage, and it's a real struggle. So they need to be replaced, and we're asking as a new program for that funding. And again, security also received a new vehicle. There's some money there to get the lighting and equipment in that vehicle, and then we have some nominal increases. And that's the extent of our presentation.
Thank you so much, Craig. Are there any questions? Member Schwarzy.
Thank you. That was short and sweet. Just a quick question regarding the security contract increase. That's a pretty significant increase. And you said there will be more man hours included because of the, I can't pronounce that.
The magnetometers?
Magnetometers, yes.
They're already in there. So the magnetometers went into service around January of this year. And that included additional personnel at the 421 security desk, and also on certain occasions when, like, for example, the inauguration when we brought them in. So that's added about 4,000 post hours a year.
4,000 a year. Okay. Thank you.
Any other questions? Okay. Thank you so much, Craig. Okay. So any old business? Any new business? Okay. We're adjourned. Thank you.